everyone. We're going to be talking about sex differences in Alzheimer's disease. And we're going to be focusing on sex differences in biomarkers and discuss how we can leverage them for precision medicine. My name is Teresa Ferretti. I'm the co-founder and chief scientific officer of a nonprofit organization called Women's Brain Project. We study sex and gender determinants to brain and mental health as the gateway to precision medicine. And today with me, we have Dr. Marc Suarez-Calvet. He's a neurologist at the Barcelona Beta Brain Research Center. He's an expert in biomarker research, and he's a collaborator of the Women's Brain Project. So hi, Marc. Thank you for being with us.
Yeah, thank you very much, and a pleasure to be here.
How about clinical trials? Because you told us there are a number of sex differences in biomarkers, and we know biomarkers are used, very important for clinical trials. And I know some clinical trials, for instance, stratify patients based on genetic status, let's say ApoE4. So what is the current status? Do you think we are using the knowledge we have on sex differences in biomarkers?
I do think that often in clinical trials, as well as in observational studies, we look at the data without stratifying between men and women. And there may be the possibility that some treatments may have a different effect depending on sex or gender. And actually that has happened in cardiovascular diseases, that some, especially primary prevention treatments, differ between men and women. So that's something that we really need to take into account, of course.
We would like to give the message that this should be done better, right, in the future, that we are starting to build the knowledge, but we are not still using this knowledge in a productive way when it comes to clinical trials, right?
Exactly. For example, in clinical trials, something that I think in Alzheimer's disease we are talking now, most of the clinical trials analyze the data stratifying by ApoE4 carriers and non-carriers. That I think something that most clinical trials nowadays do. But maybe we should also look at between men and women, and also the effect of ApoE, because there is a clear interaction between ApoE4 carriers and the sex. So that's something also to take into account.